Hello, my name is Kelvin Ampofo, and I serve on the board of directors as the 2nd District Representative of the Omega Psi Phi Fraternity Inc. If one were to say the coronavirus pandemic has changed the world, that would be an understatement. COVID-19 has changed the way we live, work, learn, and interact with others. Wearing masks, washing hands, and social distancing were implemented to minimize the spread of COVID-19. Now, there's an approved vaccine. On behalf of our 41st Grand Basileus, Dr. David E. Marion, my brothers and I would like to share some vital information regarding the vaccine. Please listen closely to the Omega Psi Phi Fraternity's 2nd District COVID-19 Task Force Team, known as the Horsemen.
My name is Wanzi Gardner. Like many of you, I've been personally impacted by this dreadful disease called COVID-19. To state it plainly, it has changed my life forever. This year in January, I lost my dad after his long but gallant struggle with Alzheimer's disease. On June 26, I lost my baby girl, Javielle, due to the lack of medical access attributed to COVID-19 protocols. She was just 28 years old. And finally, on August 16th, I lost my mom to COVID-19 related pneumonia, alone in a hospital bed in Albany, Georgia. She was a mother, she was a mom, she was a granny, she was a great granny. Mom was the last link to that generation of our family that we've now committed to the ages. In our community, 74% of us have been directly impacted or know someone who's been impacted by COVID. What this means, in almost 3 out of every 4 African Americans have lost a father, a mother, a brother, a sister, a son or a daughter, or an extended relative or friend. In my case, I've been hit twice. The sting of death and loss is so precious at times, I feel as though I'm losing my mind. The pain and agony can seem so unbearable for someone who's always been the family fixer. But this was a situation I could not fix. Through faith, the power of prayer, the presence of friends and words from good brothers you're about to hear from, and professional mental help, my head is bloody, but it's unbowed. My only ask is that you listen to our experts. I know you're skeptical about vaccines given our history. I hear you. We're here for you to make sure you have the facts so that you can't say, I didn't know. I give way to our experts. Thank you.
Hello, I'm Brother Dr. Keith Boykin, a board-certified pediatrician, fully trained in internal medicine, and a fellow of the American Academy of Pediatrics. What about vaccines? I know there's been a lot of concern about the current release vaccines, but I can assure you that safety was of the utmost importance during the trials, production, and final release of the vaccines. Usually, vaccines on average take about 3 to 5 years from idea to final release and general use. Much time is spent collecting, growing the virus, and finally have enough of the virus to produce a vaccine. The current release vaccines use a new method of learning genetic sequence, and they use that information to produce a vaccine at a much faster pace. Hence the need no longer for growing the virus, producing it, and having enough virus into the vaccine to be used. The current release vaccines are by Pfizer and Moderna. They only need to inject a chemical equivalent of the viral gene, which then causes the cell to invoke the immune response faster. Both vaccines have equal effectiveness, the largest difference being between the dosing interval between the 2 required doses, Pfizer 21 days and Moderna 28 days. Both vaccines did have a significant amount of people of color Both had about 10% African American, and overall there's about 30% people of color involved. Now, all vaccines have the potential for side effects, and it's expected that this vaccine would have no different expected side effects than any other vaccine. Now, hear me well. There is no conspiracy against people of color, but rather a need to protect our populations who have the greatest risk of complications and death from COVID-19. We know there are fewer African American people, healthcare workers, than Caucasian counterparts, and there's a significant amount of African American ancillary personnel. These are your techs, your patient transporters, and environmental personnel, for example. We expect, however, by late spring, early summer, that everyone who wants the vaccine will be vaccinated. Now, while there's no vaccine for children yet, teens as young as 16 can receive the Pfizer vaccine, and both Pfizer and Moderna are working on developing vaccines for our younger children. This would have significant impact in the fall 2021 school year, as a vaccine in this group could impact the face-to-face versus remote learning, and the availability of the vaccine would allow teachers to feel more comfortable and safe in the face-to-face environment. So finally, I say to you, we must still wear a mask. We must wash our hands, and we must practice social distancing, because even after you receive the vaccine, you will not be immediately immune nor free from getting infected by anyone with COVID-19 infection, and that's until about 1 or 2 weeks after the second dose. I will definitely be getting the vaccine. Now, we recommended it to all my family and friends.
Good day. My name is Dr. Jadan Phillips. I am a board-certified family practitioner who is also a clinical associate professor and associate dean of student and minority affairs at Stony Brook Renaissance Medical School. I have been a consultant and advocate for patients and family and friends with respect to COVID-19 pandemic and how it's impacted them. We have seen that this pandemic has reared its ugly head in our community and in our country. We have seen over 332,000 people that have died as of today. In addition to that, we have also seen its increased impact on Black and brown communities, not just with the effect immediately from COVID, but also the effect on other aspects of our communities that have been highlighted by the existence of healthcare disparities and social and racial biases. I have seen the depression and significant emotional fatigue that comes with managing these patients and also being a patient or a family member of a patient. I have seen the extreme sadness, not over just a person, but also their family and communities that have been impacted. I am from East Elmhurst, Queens, New York, which was the epicenter of this pandemic in the March to May time of 2020. And last but not least, I am also a COVID vaccine recipient. So at this time, we recommend that you strongly consider vaccinating yourself and look at spreading this information out to those that you know and be our COVID ambassadors, because at this time, things are incredibly crucial, people. We are in the midst of the surge and things are potentially going to get worse if we do nothing. So the science tells us that we must wear our masks, that we must social distance, that we must avoid unsafe situations, that we must get tested when it's appropriate. But it also says to us that we should trust this vaccine. I am post-vaccination day 4. I had some initial pain in my left shoulder, which was the site where I received my vaccine. But since that time, that pain is resolved and I've had no other symptoms. I've had no fever or chills. I've had no body aches. So with that being said, folks, let's go out there and let's do the right thing so we can support our community.
You've heard the personal, somber testimony and affirmation of the seriousness of COVID-19. You've heard from a medical doctor that provided the history and facts concerning the vaccine, including details regarding the clinical trials. You've heard from another medical doctor who has received the vaccine. He works the COVID-19 wards inside the hospitals and shared his chilling experiences. Next steps are clear. It's time for all of us to trust. TRUST. Take a COVID-19 test. Remain vigilant. Uplift others. Share the information. The information you've heard today and additional resources can be found on our 2nd District website, www.opp2d.org. And talk to your medical provider to take steps to get vaccinated. It's important for everyone to use all available resources to help stop this pandemic.